You might get asked about West zones in your FRCA primary exam, and these refer to the tricky issue of ventilation perfusion matching in the lung. Because it's all very well inhaling air and sending that air into all the alveoli in the lung, but you've also got to send blood to the right places to ensure you're picking up all the oxygen and bringing it back to the heart to send it around the body. And the process of matching your ventilation to the right areas of the lung and your blood delivery to those areas of the lung is called ventilation perfusion, or VQ matching, and it's actually quite an involved process. If you take your thoracic cavity or thoracic cage that's made by your rib cage and your diaphragm, your lungs are kind of suspended off the inner wall of your thoracic cage, and the weight of the lung tissue pulls downwards. And this means that the lung tissue at the top of the lung is kind of pulled open, while the lung at the bottom is squished shut, and in the middle it's sort of halfway in between. Meanwhile, your heart is trying to pump blood up against gravity, and gravity means that the higher up you go, the less blood you get, because blood is preferentially sent to the bottom of the lung because gravity's pulling it downwards. So the top areas of the lungs have the least blood supply and the bottom have the most. So you can see there's a mismatch here because there's more air going to the top but more blood going to the bottom, and this is where we face an issue. And these three different areas are called West zones. So in West zone 1, the highest up, the pressure of the air in the alveolus tends to be higher than even the arterial pressure, which in turn is higher than the venous pressure. So what happens is the ventilation is very good, but the perfusion is not so good. So you end up getting dead space, which is simply areas of the lung or respiratory tract that are ventilated but not perfused. In West Zone 2, sort of the middle of the lung, we find it's a bit more balanced. The pressure of the ventilation, the air pressure, is in between your arterial pressure and your venous pressure, so you have much better matching of the ventilation and the perfusion. So this is where your most efficient gas transfer is going to be happening. And in West Zone 3, so this is typically at the bottom, there's very good blood supply, but less good ventilation. So the arterial pressure and the venous pressure are both higher than the air pressure, and as a result, you're predisposed to shunt, which is where there is perfusion or blood supply, but not enough ventilation. So dead space and shunt both represent inefficient gas exchange, which we're trying to avoid, and we're trying to keep as much lung tissue in this West Zone 2 area as possible, because that's where you're getting efficient gas transfer. So when you're talking about West zones, they are physiological zones. They are theoretical areas depending on how the ventilation and the perfusion is behaving. It is not strictly the top of the lung is 1 and the bottom of the lung is 3. It's just that's how they tend to behave in an upright human because of gravity. These zones can occur anywhere in the lung depending on the position of the patient, what pathology they've got going on, and what treatments they're getting. So if you have a patient on a ventilator and you've given them lots and lots of PEEP and you're really overinflating their airways, you're going to recruit more and more of their lung tissue into a zone 1. To start with, a bit of PEEP is good because it will inflate the lung that isn't inflated and it will help bring stuff from zone 3 into zone 2. But if you do it too much, like in gas trapping in asthma, you end up pushing lung tissue up into zone 1, which is not useful gas exchange. And for example, when we prone patients for things like severe ARDS or COVID, it's because we're trying to change how gravity's acting on the lung tissue and re-divert some of the blood to areas of the lung that are less affected by disease and less inflamed and collapsed. So that's a brief summary of the West zones that you might get asked about.